Dr. Nicole Freels back again. Today we are with a patient who is a diabetic. We are going to go ahead and trim. She has tons of calluses. Did you trim these yourself? Or did someone? Okay, so we're going to take over. She's not allowed to trim her calluses anymore because she has severe neuropathy. We did our little monofilament test, this little guy right here, to detect sensation. She didn't feel anything, nothing. So we definitely want to take this over for her. So let's go ahead and get started. Go over here, this big, I can see where you kind of, you get in there closer, where you.
I think I'm an expert, but I'm not.
I was going to say, what are you trimming with these? Because it looks kind of flat, like a blade or something.
A blade.
Okay, you're fired. I want you to throw your blades away.
And then I got a big thing that you like grate vegetables with.
Have you ever gone a little too deep?
Yes.
And then how'd that turn out for you?
Well, I put a Band-Aid on there and it bleeds forever.
Bleeds forever.
It's like a eye head injury.
You know, and that's good because you have good circulation. Some of our viewers do not have good circulation, so if they cut themselves, they are stuck with a wound. That wound, could take a long, long time to heal, because that's how wounds heal, right, through blood flow. Not only that, you're at a greater risk for infection. As a diabetic, you are immunocompromised, meaning you don't heal very quickly. Golly, these are hard as a rock. Might need a blade handle for. Normally I don't, but I need some leverage on this.
I've got one with a handle.
Yeah, we'll pause for just a second. Okay, so we're back. Bigger blade. Got a nice handle here to get some leverage. I'll go ahead and trim up your toenails today for you if you want to while you're here. You're not going around barefoot in the house, are you? Okay, number one, you're a diabetic. Let's not do that. Number two, that will make these calluses build up a lot faster than they have to. So, some type of good, thick and cushy slipper would be great. There's a slipper called Acorn, which is really comfortable. Now we're getting down to some normal skin. How long have you been treating these calluses on your own?
I'm 61 for 40 years.
So for 40 years. Well, you know, and these, you're getting these because they're pressure points. So what I want to do is talk also about getting a diabetic insert, a pair of diabetic shoes, because clearly you qualify for that. That's the whole point of diabetic shoes, is to offload these areas so callousing doesn't build up. And, you know, once this callus builds up, it's going to crack. That crack will then ulcerate. The ulcer can get infected. And then once it's infected, the bone can get infected. So then we're looking at an amputation or IV antibiotics. So we want to really stop it at the get-go. Okay, let's move on to the second one here.
Is fungus infection like on that toenail?
It is a fungal infection, yes. Yes. And like I told you before, that's cosmetic, so technically you don't have to treat it. We can just kind of manage it through regular nail trims in the office. Ooh-wee.
So if I wasn't on the anti-rejection medicine, I could take oral stuff?
Correct. Because you have good blood flow. Patients that don't have good blood flow, we don't prescribe the Lamisil for, or the oral medicine for the fungus in the toenails or the skin, because the blood flow is not getting down to the nail itself. So it's kind of a waste of time. So that's whenever we, you know, really want to consider laser.
How do you know I got good blood flow?
Because I checked your circulation when we were chatting.
Okay. For a pulse and stuff?
For a pulse, yeah. Both of your pulses were very strong. Okay, just whittling away, guys. So I'll get you scheduled with our diabetic shoe fitter. And so we can do some shoe shopping. You can look through the catalog. I will tell you, you know, when I started practicing, 11 years ago, or longer than that, I should say, but had my own practice for 11 years, the shoes were hideous. I mean, they have really done a good job with.
So they're not the big black ones.
Oh God, no.
You know what I'm talking about?
I know what you're talking about because when I was working at the VA, you know what their options were?
Yeah,
brown or black.
Uh-huh.
That was it. There was no selection. But now they've got like tennis shoes, Mary Jane's.
Oh,
You know, yeah. I was really impressed with, especially in the last like 3 years. Okay.
So they finally started listening.
They finally did.
I think that's the one I worked on before I came.
You did a pretty good job. I mean, you're not allowed to ever do it again, but I hope you enjoyed it while it lasted.
Excellent.
And as a diabetic, you get first priority coming in our office. So if you have any emergencies, please call. We have 4 providers here, and someone can get you in on their schedule that day.
Okay.
Look at that. I'll be sweating here by the time I'm over. I'm done. But this is so important to get these off.
I'll probably feel better.
Oh my gosh.
Well, a lot of times when they build up, it causes my hip hurts more.
Probably because you're altering your gait and the way you're walking.
Mm-hmm.
Do you have any knee pain? Or just the hip?
I don't know. It's normally this one, but here lately it's been this one. I fell down my steps.
Oh no. Do you have issues with balance, or do you feel unsteady, anything like that?
Oh, this time. I feel unbalanced. Well, when it rains, I feel I catch. I feel like I'm going to fall. This when that you know.
Sure.
But normally I'm okay. But when I fell, it wasn't. I was carrying stuff.
Gotcha.
My bedroom's 15 steps up, so I was carrying stuff and I wasn't holding on to the handrail.
I see.
But I normally hold on to the handrail going in.
Me too.
I always have problems with steps.
I've got weak ankles, and look at that off just a minute. I'm going to tilt you down a little bit and go ahead and do your nail trim. Get you. Look at all this. Look at all the callus in there. I mean, you probably got, I don't know,
And you should have seen how much I had at home. I should have brought it in a little baggie.
How are you, I gotta know this, how are you trimming your calluses with a blade? I mean, you must take yoga or do something. You know?
I do take yoga.
There you go.
Well, when I was going to the, they sell their little stuff that they use at the hood
No,
stores.
they don't.
Yes, they do.
They sell the blades?
Yeah, they sell the blades, and then they got this thing that looks like a vegetable. It's a big old handle. It's like a vegetable
grater?
And I got one of those.
Oh my God. Is this local? I might have to go talk to somebody.
Yeah, but you can get them at all the hood stores. Where they sell the wigs and weave.
We'll Dremel these guys here. Oh my
I
gosh.
cut my toenails too.
I can see they're not too bad. They're just crumbly. And
Yeah.
you know what? Do me a favor before you come in next time. Go ahead and soak your feet. It'll make these calluses and your nails so much softer.
Yeah.
So it'll make it more comfortable because I know.
I normally do it in Epsom salt. Is that okay?
That'd be perfect.
Okay, great.
Like right before you come in.
Okay. Yeah, I have to do that myself. That's why I did it this morning after I took my shower.
The nails can get so hard like this, and it's almost like paring a rock to be able to grab something.
Mm-hmm.
When it's softer, it's more pliable, and I can grab onto it.
Mm-hmm.
Okay? Well, now let's get the power tools out. I think I've got one up here.
Lord, we got a whole YouTube.
We are, right? How long is this video so far, Caitlin?
About 7.5 minutes.
Mercy. I feel like I've been trimming those calluses for 20 minutes. But yeah, they should feel much better. Are you ticklish at all?
I can't feel anything.
Oh, that's right. I forgot.
Hey,
How'd I
that might
forget?
be good for when you take my toenails off.
That actually is true.
I told my doctor in Cincinnati, I said, I think I've got flesh-eating bacteria on my big toe.
Oh my word.
And she was like, what? I'm just telling you. I said, and I want to go to the beach, and I cannot go to the beach like this. And she said, you can't go to the beach like this. No, I can't.
flesh-eating bacteria. Or just some common fungus. I mean, it's pretty close, pretty similar.
Yeah.
Well, I will have to warn our viewers here. I see on your toenail here, the second one on the right foot, where you trimmed it yourself. This happens all the time. I can see some dried blood. You got too close.
Yeah.
You are lucky it healed, but some people it's not going to heal. And this could have led to a possible toe amputation.
I did that too. See right there in that corner?
Oh, well, I'm glad we're confessing now. Let's not do this. If you can't feel your feet, you definitely don't need to be, getting a blade or even trimming toenails. You know, your insurance typically covers us to do it every 9 weeks.
Okay.
So come in, get evaluated, and then we can determine if you are at risk and qualify for this.
Okay.
That's why they do cover it, because they don't want things to happen like this.
Okay.
Well, I'm going to go grab my medical assistant. She's going to come in, get y'all cleaned up and lotioned up. So, everybody, I hope you learned something today. Don't be like this one over here.
They're waving goodbye. Look.
They're waving goodbye. Thanks for tuning in, everybody. Don't forget, sign up for our channel, hit the notification bell. If you have any comments, please drop them below. I'm happy to answer any questions you do have. See you guys next time.